Hey everyone, Elizabeth Scala here. Welcome back to our series regarding elbow surgery and the follow-up recovery that occurs. As a previous patient of elbow surgery, I have started this vlog to give you tidbits of information that will help you, hopefully, along your healing journey. Today I want to talk about something I have alluded to in prior videos. I keep mentioning how you and I, patients that are recovering from surgery, are fall risks. We are fall risk. And, I'm not saying this to speak down on us or to say, there's something wrong with us. It's just the very nature of recovery. In fact, anybody who's had a surgery and requires rehabilitation from that procedure is likely a fall risk. There are reasons why you're potentially a fall risk. One could be if you are prescribed opioid or narcotic medications to help you handle the pain that you may have shortly after surgery and in the weeks during your acute rehabilitation. So medications that you're given to help with pain. Secondly, you may already be on standing medications for other chronic health conditions, other medications related to surgery, anything that you take that impacts your balance, your ability at depth perception, and just your stability on your feet. So surgery mixed with medications you're already taking, your standing pills, and then add to it medications because of surgery. Wow, now a heightened risk for falling. The other thing is, think about it. Prior to surgery, albeit regardless of whatever medical or chronic conditions you may already have had, but prior to surgery, you were walking around with two arms that could dangle at your side that helped you to balance when you walked. It's just the nature of us as human beings, how we stand up on 2 feet and use our arms to sway as we walk, right? Interestingly enough, and my occupational therapist pointed this out to me, I told her one day at therapy how my husband and I loved hiking and enjoy spending time on trails out in Mother Nature, that sort of thing. And she said, "Whoa, Elizabeth, while I'm happy to hear you're interested in walking, because it is good to ambulate after surgery, I will advise you against intense, difficult hiking, unless you have a hiking stick or hiking poles. Because if you have a clunky, bent, or immobile arm, or even something that's in a sling shortly after surgery, that's now putting you out of balance. Again, making you at greater risk for falling. So you've got your medications, you've got your balance just from the sheer nature that one arm is now likely different than the other. And then you do have other things that can impact your increased fall risk ability. With taking medications for pain or for the surgery or for nervous system conditions, those medications, and any medications you take, to be honest with you, can increase your risk for dehydration. And if you're dehydrated, it impacts your blood sugar, it impacts your blood pressure, it impacts when you go from sitting to standing. When you sit up quickly, you might become lightheaded and go, "Whoa, I just got dizzy." So your dizziness, your hydration levels, moving from one way you are, whether it's lying down to sitting or sitting to standing, just those abrupt changes in levels can put you at increased risk for falls. And finally, with your healing of your elbow, of your surgery, with those medications, with the dehydration, with all of the changes going on in your body as your body attempts to repair itself, you may notice an increase in your feeling groggy or feeling tired or just feeling lethargic, sleepy. You're just slower to react. And that also puts you at a greater risk for falls. So my friend, surgical patient like I was, you are at greater risk for fall. Now, what can you do about it? I would advise you to be aware of this and be on the lookout. So right off the bat, as you're walking and ambulating, moving about your home, are there any cords? Is there any carpeting? Are there any uneven surfaces that could trip you up, increasing your risk to stumble to the ground? Secondly, your clothing. And now, as someone who wears loose-fitting, flowing, bohemian-style hippie clothes, I know that my pant legs increase my risk for falls because many of my pant legs flow out or they're just loosely fitting, and the pant legs get kind of turled up inside each other. In fact, speaking of clothing, 1 week, a couple months after my surgery, my husband and I were getting trash and other bulky items that our garbage men wouldn't pick up, and we were bringing these to the local dump. So we were loading up the back of his pickup truck with things that we were going to dump over at that area. And I had 2 bags in my hands because at that point my arm was doing much better and I was able to carry heavier items. And I had 2 large black bags in my hands, and my boots I was wearing, because I was thinking to myself, I don't want to wear flip-flops, I don't want to wear shoes that might cause me to trip and fall. I'm wearing boots today. My boot laces got intertangled with each other and my boots got tied up together and I fell. And I said to myself, oh my goodness, I know I'm a fall risk. So be on the lookout for your clothing, for your shoe, your footwear, what you're wearing, what you're putting on your body, as it might also trip you up. And then the final thing I want to say before closing is sleep. During the night, you are extremely at a greater risk for falling. The room is likely dark. The area is, dim, dark, pitch black, depending on how you like to sleep. And if you're on medications that increase your need for hydrating, drinking a lot of water, you may find yourself, as I did, needing to get up to the bathroom more frequently during the night. And I noticed this myself. I would sit at the edge of the bed and go, ooh, I'm a little woozy. Let me sit at the edge of the bed before I stand. And then when I stood, I wanted to make sure there was nothing on the ground around me. No vacuum cleaner cords, no piles of books, no children's toys, no dog beds, nothing on your path from your bed to your bathroom. And then the lighting, adjusting yourself and getting to that bathroom. And there were times where I would literally, TMI, be sitting on my toilet and feeling like, ooh, I'm really kind of off balance right now. I've got to hold on to the wall or a handle or just something nearby. So be careful in the night getting up from sleep, as again, a post-surgical patient, we are at increased risk for falls. So move things out of your way, watch your clothing and footwear, make sure nothing is in place of you and tripping, stay hydrated, and change positions slowly. Meaning when you're lying down, sit up and then pause at the edge of the bed before moving. If you're sitting in a chair and you're going to stand, stand up slowly, making sure you have something to hold on to so that you don't tumble down and fall. All right, I hope you've enjoyed this. I'd love to hear what other fall risks you've come in contact with. What other things tripped you up and how did you handle it? Comments below. Leave questions if you have them. Happy to answer. And take a look around this YouTube channel, as I have plenty more videos in this series, as well as yoga and Qigong videos to help with your holistic healing. Thanks all. Have a great day.